everyone! What's up with Doc Nona? Here I am with another patient. First, greet muna.
Hi, good morning or good evening or good afternoon everyone. It depends on when you're watching this video, but have a great day.
Okay, so ito ang ating topic ngayon. Ang topic natin, first, number 1, desensitizing a tooth. Okay, first and foremost, everybody knows I don't like root canal. So, kwento niya muna kung bakit pumayag siya i-desensitize ang kanyang tooth instead of extracting or doing root canal, which in fact that I don't do root canal. So a patient here would like to say something about desensitizing against root canal. Okay?
Okay, so I do prefer desensitizing over root canal. The reason is yung how I was informed or how I found out what they do during root canal. It's very invasive. I really don't like it. I find it very invasive compared to the mummification or this desensitizing, which is they just put it's a medicine or something that they put inside the tooth, and then you wait it out for a couple of days until your tooth absorbs it, and then it kind of like same as whatever the term is, which is mummification. It mummifies the roots of the teeth, so you don't pull it out or do anything. You just wait it out. So they put in the medicine, you wait for a couple of days, it mummifies the roots, so you don't feel anything. So very non-invasive, very safe. So I really would prefer it over root canal, which is very invasive. You could have a lot of complications compared to mummification.
Yes. So with this is a tooth. How do you feel when a tooth is okay? Other people are curious. So how does it feel if you have this solution or this material being put on your tooth? Ano ang initial sensation ng tooth mo? That people are curious.
It's you just feel a slight pressure. I can't say for most patients, but for me, it's only a slight pressure since I do feel like I have a high pain tolerance. But yeah, it's just a pressure. It doesn't really hurt. It's just like someone's pressing down on your tooth, and then after maybe about 5 to 10 minutes, it goes away, and it just stays like that.
It numbs the tooth. Does it numb your tooth?
Well, it doesn't really feel like anything. Like it just feels like your normal everyday tooth.
So you choose mummification, desensitizing a tooth over root canal therapy, right?
Yes.
Okay. Now, with this desensitizing a tooth, it is safe. Actually, depends on the dentist on what kind of material they're going to put on the tooth. And mind you, it must not have any leakage. So it depends. If you really want to kill the tooth, you just have to let it stay there forever because it will stop. It will stop in itself. Once it has been absorbed by the tooth, that material will turn out to be color white. Okay, it used to be blue. So every time it it tries to drip in the solution inside the dentine, this material turns out to be pale in color. When you open it, when time comes you want to open it, it just turns out to be just nothing. It's just white. So here, this is non-invasive. At least the tooth is still alive. You only desensitize the part of the tooth that is causing pain. Okay? And yet, the tooth is still alive. It still takes nutrients, and the tooth will be preserved in such a way that it will not become brittle nor a foreign body to the mouth. Once it's a foreign body, unlike the root canal, the body wants to reject it. Because why? It's like a cadaver, a dead thing on your mouth, a dead tooth inside your mouth. And that causes also bad breath. Okay? You're keeping a dead thing inside your mouth, and has a smell. You cannot you're not when you're the one who is wearing that tooth, hardly would you notice that there's something wrong with your mouth because your nose get used to it. You get immune with the scent. But if you are a sensitive person, you try to close your nose like that, you don't breathe for a while, and then you try to touch that tooth with your finger, and then you smell it, then you'll find it out. It smells so awful. Okay? Now, upon talking about desensitizing a tooth, okay, how did you discover that I don't do root canal? Is it from me? Did I say it? Did I happen to educate you? Or did I orient you? How?
Yes, because I've been with Doctora for I don't know how many years, but it's been a long time. And I really do prefer her over any other doctors just because I really don't like getting my teeth pulled out. I really like my teeth being preserved as much as possible. So it doesn't really matter how small the teeth is, or because I've gone to different dentists before and they would let me know that, oh, this teeth needs to be pulled out, this teeth needs to be root canaled, you have this, you have that. And they don't really give you an option to save your teeth. So the first thing they do is just, yeah, pull it out, pull it out, pull it out, which I really don't like because I really would like to preserve my teeth as much as possible. Plus, if you do the root canal, it would cost you more over the mummification.
Yes. Mummification, desensitizing is cheaper compared with root canal therapy. And it is not how many visits, it's just one sitting. And then if you decided, let's say you just don't want to kill the whole tooth, you just have to come back after 5 days or 10 days. We just have to remove it and then close it permanently. That's it. And definitely your tooth is still alive, even if we just let it stay there. As long as it depends on the size of the material that you put inside, then it gives you an idea of how range the portion of the tooth will be mummified, but definitely not the whole tooth. Okay? In her case, I think it depends on the material that I place, but as much as possible, we try to keep it a little bit still alive so it could still get nutrients. But if it just so happen it get mummifies, then that's it. Then at least she won't have any problem anymore. And yet it is non-invasive, there is no bacteria. And definitely no cyst will occur. So another thing is, if you remember right, I showed you, I'm showing you on the slideshow, a tooth that it is alive and yet it's so small already. I did not extract that. And we even placed a no metal showing bridge. So how do you feel about that?
I'm really happy with the bridge. It's just so perfect. Wouldn't even know that it's a bridge. It's not my real teeth since it looks like my real teeth. It's not too far out. When it comes to the color, yeah, the shade, the color of the teeth, it's not really far out. It's like it's your teeth. Any other person wouldn't know unless I tell them that it's not my real teeth. So I'm really, really happy with that. And yeah, I was actually a bit sad that I had that tooth pulled out. I had it pulled out during COVID. And I was sad because I could have come to Doctora then and had her save my tooth, which does not really need to be pulled out. But
we had lost connection, right?
Yeah. I didn't know that she was operating during COVID time, so that's why I got it pulled out from a different dentist, which I so regret. Yeah. So
but
yeah.
even then, we were able to do something about it, and I would like to really thank you, my laboratory. You know who you are, and you're the best, right?
Yeah, they're the best. As in, go see doc if you need something fixed with your teeth, like pastas, or if you're having gum problems or anything like that. Just go see doc.
As long as you have a legit referral to me. So, with your bridge, I'm so happy that you're happy, and that needs maintenance for about every 6 months. I get to see you, and with her gums and all her tooth problems are all fixed, and I hope everything will be just fine. And thank you, dear patient, for having this, chance for me to vlog. Even if you're wearing your face mask, I'm still happy.
It's my pleasure, Doc.
So, guys, remember, there is always an alternative aside from root canal. We have to mummify a tooth without causing further pain to the patient. Okay? No invasion of the root pulp. Okay? And with regards to porcelain, I am so happy again, sir. You did a very good job, because with porcelain, it's so hard to really find the right shade. It's either you have the right shade once it's being done by the laboratory, it's either plus and minus the shade. It's one step up higher or one step lower than the shade. But this is almost near to perfect.
Almost. I would say it's perfect. But I don't have like a 20/20 vision. Not that bad, but I would say
Almost
looking
near.
at it, it looks perfect.
And guys, with the camera, with the zoom micro camera, we were able to detect our naked eyes. But if you use our naked eyes, everything seems to be fine, as if there's no more cement spillage. But here, I'm showing you on the slideshow. Be careful. You should have a second look, a third look with all your jacket crowns and bridges. Once it's cemented, make sure all the surroundings of your cervical area of that crown are all cleaned up, because there is a chance you might even get gum diseases. For all those of you who doesn't know, I am a periodontist, and so I'm extra careful when putting jacket crowns. You have to make sure that no cement will be left. So my patient is a witness. We did some camera inspection, right?
Yes.
And what did you see?
Cement. Yeah, and yeah.
Even if I cleaned it, right?
Yeah. Even after you clean it using your naked eye, there's still a little cement that's stuck on those little crevices that you won't be able to see. Doc really needed the micro camera to like look at every angle, every little crevices and nooks within your teeth or around your teeth, and she took it all out.
And I am very thankful also with the new technology, we can see through things with, our naked eyes are very deceiving. So it is very important for us to really check out first, before, and after. And I let my patient see what's really going on with their teeth. I don't hide anything. Why? It's their right to know what's going on with their mouth. And it is my obligation and duty to make sure that there will be no secondary infection, no secondary problem, no secondary whatever secondary pain that she'll have. So I hope I satisfied my patient today, and I'm very happy that you had this vlog with me. And I hope you guys learned something today about desensitizing a tooth, mummification against root canal treatment, and having a no metal show bridge, which is we were able to meet up with the shade necessary for her teeth. So are you happy?
Very happy.
So is there anything you want to part with our audience right now before we go?
If you're really having problems, as I've said earlier, as long as you know someone who's a patient of Doc, go get that referral from that someone you know and go see Doc. I would really vouch for her 110% or more. Go see her. Please do. I know there's a lot of people that have a problem with their teeth or teeth hygiene. Really, go see her. She's the best. So with that, I want to say thank you, Doc, for taking care of my teeth.
And thank you for your trust. Trust is important. Thank you for your trust. Thank you for your beliefs. Okay, I've been a dentist for so many years, like more than 35 years, and it takes experience in every aspect to be able to perfect or master a case. So I'm very glad that my patients, most of my patients, since I started Facebook, they see me and they contact me. And I'm glad that they're back once again because we lost contact because I have this bad attitude of changing my number every year. So let's say bye-bye now.
Bye. Thank you for watching.
Bye.